Workers in many different occupations are at risk of exposure to infections. Examples of those at risk are people who work in housekeeping, maintenance, laundry, direct support, or anyone in the healthcare field. And what standard precautions really means, let's take a look at how the Centers for Disease Control and Prevention define standard precautions. Standard precautions represents a system of barrier precautions to be used by all personnel for contact with blood, body fluids, secretions, excretions, non-intact skin, and mucous membranes, regardless of the person's diagnosis. This system includes the concepts of body substance isolation, which reduces the risk of transmitting pathogens from moist body substances, and universal precautions, which reduces the risk of transmitting bloodborne pathogens. There is a rising concern about exposure to blood due to bloodborne pathogens. You're probably asking yourself, what is a pathogen? Pathogens are disease-causing microorganisms that are found everywhere in the environment, on humans, and animals. Pathogens found in the blood are called bloodborne pathogens. Some examples of bloodborne diseases are hepatitis B, hepatitis C, HIV, and malaria. Standard precautions is an approach to infection control that treats all human blood and certain body fluids as if they are infectious. Since these pathogens are too small to be seen by the naked eye, and you can't tell by looking at an individual whether they have a disease, you should protect yourself with simple and effective barriers. This is the rationale of standard precautions. Transmission-based precautions, in addition to standard precautions, are used when someone is suspected of being infected with a highly contagious pathogen. Transmission-based precautions are required where airborne, droplet, and contact transmission of infectious organisms may occur. Transmission-based precautions would be used if a person has chickenpox, measles, or an infection, to name a few. It is not always possible to know whether or not a person is infected with an infectious disease. Universal precautions is made up of a system of safeguards designed to help protect you and the people you support. Safeguards are things like personal protective equipment, safe work practices, good hand washing, good housekeeping, and vaccinations. All of these systems should be used together to form a protective barrier. We'll discuss these safeguards in more detail later. There are some people who may have an infectious disease and not show any symptoms or even be aware of their infection. For example, how many of you know the story of Mary Malone, also known as Typhoid Mary? Mary was the first person found to be a healthy carrier of typhoid fever in the United States. Typhoid fever is a life-threatening illness caused by the bacterium Salmonella typhi. You can get typhoid fever if you eat food or drink beverages that have been handled by a person who is shedding Salmonella typhi. Mary earned her living as a cook for private families. When several outbreaks of typhoid fever developed in homes where she worked, the public health officials questioned her. Under questioning, she stated she rarely washed her hands when cooking and felt it wasn't needed. She also insisted she never had typhoid fever and had always been healthy. However, the health officials linked the outbreaks back to her. After her death in 1938, the autopsy revealed that her gallbladder was still actively shedding typhoid bacteria. This example helps us to understand the importance of following standard precaution procedures at all times. Somehow, pathogens need to get inside your body to cause an infection. Let's take a few minutes to discuss how these pathogens can get inside your body. It can happen from a sharp object contaminated with the infectious material, such as a needle, broken glass, wires, or any other object that can break or cut your skin. From openings in your skin, This would include cuts, nicks, abrasions, skin infections, acne, and surgical incisions. Through your mucous membranes. Mucous membranes are the moist surfaces of your mouth, eyes, and nose. By touching contaminated environmental surfaces and transferring the contaminant to mucous membranes or open skin, surfaces can be heavily contaminated without visible signs of contamination. Diseases that are transmitted from other people or animals are called communicable diseases. Some examples of communicable diseases are measles, strep throat, and colds. Standard precautions should be used in the care of all people and used regardless of whether or not the person is known to have a communicable disease. In order for a disease to spread to others, certain conditions are needed. This is sometimes called the chain of infection. Let's take a few minutes to discuss these conditions. First of all, there must be an agent like a virus, fungus, or bacteria that can cause the illness. The agent also must have a place to live. This is called a host. Humans, animals, and insects are the most common hosts, although agents can also live in the environment. The agent must also have the right environment to survive. Often moist, dark places help them to live and grow. The agent must be able to enter the host. For example, a person who has a break in their skin or someone who breathes in the agent. An agent must have a way to move from its host to infect others. This is called transmission. Some examples are through blood, body fluids, a sneeze, or a cough. There also must be a person who can catch the disease. If someone can't fight off the germ, they can become infected. This is called being susceptible. This completes the chain of infection. The cycle continues as the agent is passed on to another host. The easiest way to remember how diseases can spread is through the David method. Communicable diseases are mainly spread in the following ways. Direct. This is through person-to-person contact. Airborne. This simply means through the air. These infectious droplets remain suspended in the air because they are carried by microscopic droplet nuclei or dust particles. They can land on or be inhaled by the host. Vector. This occurs when an organism, such as a tick, carries disease-causing microorganisms from one host to another. Indirect. This occurs when microorganisms are transmitted by contaminated items such as food, water, medication, and equipment. In other words, person, object, person. Droplets. When someone coughs, sneezes, or talks, tiny droplets may be generated. These infectious droplets propel a short distance through the air and land in the host's eyes, nose, or mouth. Droplets do not remain suspended in the air. The spread of infectious diseases can be stopped by killing the agent, changing the environment so the agent can't survive, wearing protective gear, removing the agent's means of spreading, and making sure people are immune to the agent through immunization. This is commonly called breaking the chain of infection. The most important and effective thing you can do to help prevent the spread of infection is to wash your hands. Hand washing is often taken for granted because it can be routine, but good hand washing stops the spread of contaminants from your hands to other parts of your body or other surfaces you may come in contact with. Let's take a few minutes to go over some general guidelines to follow when washing your hands. If you remove your gloves, wash your hands thoroughly. If skin comes into direct contact with blood or other infectious material, wash with soap and water as soon as possible. If you are using antiseptic towelettes or hand sanitizers, you should still wash your hands as soon as possible after touching something that is visibly contaminated. Remember, good hand washing doesn't take a lot of time. Follow these 6 steps for good hand washing. Remove any jewelry you are wearing if possible before washing your hands. Bacteria can thrive under rings and watches. When washing your hands, use warm, running water. Wet your hands and apply soap. Use plenty of soap to create a good lather. Vigorously rub together all surfaces of your hands for 15 to 20 seconds. Friction helps remove dirt and microorganisms. Pay close attention to cuticles and under your fingernails. Keep splashes to a minimum and try not to touch the sink itself. Rinse your hands, keeping your hands lower than your elbows. Dry your wrists and hands completely with a clean paper towel. It is best to pat your hands dry rather than rubbing them. This helps prevent your hands from chapping and cracking. Turn off the faucet. Remember, don't touch the faucet with your clean hands. Use a clean paper towel. Remember these 6 steps the next time you wash your hands or assist the people you support to wash their hands. You're probably now asking yourself, how often should I wash my hands? The following are general guidelines for washing your hands. When you arrive at work, before and after assisting someone with personal care, before and after wearing gloves, before and after you eat, before and after cooking, before leaving work, after blowing your nose, touching your face or hair, after using the bathroom, after any cleanup you do, after smoking, or whenever your hands are soiled. Standard Precautions requires the wearing of personal protective equipment whenever you anticipate the possibility of splashing or spraying of blood or other body fluids, such as mucus, drainage, or emesis. Personal protective equipment helps protect you from contact with blood or other potentially infectious material. Personal protective equipment includes gloves, masks, gowns, aprons, face shields, protective eyewear, mouthpieces, and resuscitation bags or other ventilation devices. Personal protective equipment must be appropriate for the task. You should wear as much as you anticipate you will need to keep blood and other infectious materials off your skin, mucous membranes, or clothing. Anytime the personal protective equipment is torn or contaminated, remove the equipment and replace as soon as possible. Gloves should always be used whenever you anticipate contact with blood, potentially infectious material, mucous membranes, or non-intact skin. When working directly with people, single-use disposable gloves should be worn. Single-use disposable gloves are just that. They should be used only once and then disposed of immediately. The wearing of gloves does not substitute for good hand washing. It's not acceptable to wear the same gloves or wash gloves between each person. Another type of glove you may use is a utility glove. Utility gloves are generally used during housekeeping. Utility gloves should be cleaned after every use with soap and water and then dipped in bleach solution. The gloves should be worn, not handled, during this cleaning and sanitizing procedure. Utility gloves are not used when working with people. They are only appropriate for cleaning. Because gloves can be torn or damaged, always bandage any cuts or open areas on your hands before applying gloves. Replace the gloves as soon as possible if they are contaminated, torn, punctured, or damaged in any way. Follow these general guidelines to determine when to wear gloves. Anytime you are handling blood or body fluids. Anytime you have open wounds on your hands. Anytime there is potential to come into contact with objects contaminated with blood or body fluids. If you are touching mucous membranes. When touching non-intact skin of any person. Anytime you are cleaning contaminated or potentially contaminated surfaces, equipment, or objects. Good housekeeping helps protect everyone and is everyone's responsibility. Carefully follow your agency's policies and procedures regarding handling infectious materials. The following are some general rules when dealing with infectious materials. Always wear gloves when handling infectious materials. Handle used equipment soiled with blood or other potentially infectious materials with care. Do not let the equipment touch your skin, mucous membranes, clothing, or other items in the environment. Do not eat, drink, smoke, apply cosmetics or lip balms, or handle contact lenses where there is reasonable chance you have been exposed to blood or body fluids. Do not keep food and drink in places where blood or other potentially infectious materials are present. Clean reusable equipment appropriately before using it for another person. Single-use items should be discarded. Be careful to prevent injuries from needles and other sharp instruments when using, cleaning, or disposing of them. Never bend, recap, or break needles after use. Dispose of contaminated sharps immediately after use in appropriately labeled or color-coded, leak-proof, and puncture-resistant containers. Report any container that is full. Remember, safety razors and razor blades are also considered sharp material. Follow your agency's guidelines when disposing of sharp materials. To prevent contamination, handle soiled linen as little as possible and with minimum agitation. Gloves should be worn. Without sorting or rinsing, place soiled linens in a leak-proof bag in the area where it was used. Follow your agency's guidelines for handling contaminated linens. Transport specimens in closed containers. Wear gloves and handle the containers carefully. Specimens taken to the doctor should be placed in a closable plastic bag. Carry waste containers away from your body. Clean all blood and body fluid spills promptly according to your agency's policy. Everyone should know what to do if an accidental exposure of blood or body fluids occur, such as a needle stick injury or a splash into the eyes or mouth. This is called a significant exposure. If you are involved with a significant exposure, don't panic. Immediately wash the affected skin with soap and water. Flush affected mucous membranes, such as eyes, with water. Report the incident to your supervisor immediately. There are a number of steps that must be taken in the first 24 hours to decrease your risk of becoming ill, so quick reporting is essential. Follow your agency's guidelines when dealing with any accidental exposure to blood or body fluids. If there is a blood spill, your agency may have a blood spill kit for your use. Follow your agency's policy for using your specific kit. Infection control practices are easy to ignore because they can be so basic, but you must take the time and make the effort to consistently follow infection control procedures. Let's take a few minutes to summarize some of the main points when following standard precaution guidelines. Pathogens are disease-causing microorganisms that can be found everywhere in the environment, on humans and animals. Standard precautions is an approach to infection control that treats blood and body fluids as if they are infectious. Standard precautions includes the concepts of universal precautions and body substance isolation. It is not always possible to know whether a person is infected with a disease. The person may not show any signs or symptoms or even be aware of their infection. Standard precautions are made up of a system of safeguards designed to help protect you and the people you support. These safeguards include personal protective equipment, safe work practices, good hand washing, good housekeeping, and vaccination. All must be used together to form an effective barrier. Pathogens need to get inside of your body to cause an infection. Some ways they may enter your body are by punctures from sharp objects or openings in your skin. Pathogens can also enter through mucous membranes of your mouth, eyes, nose, or by touching contaminated environmental surfaces. In order for a disease to spread to others, certain conditions are needed. These conditions include an agent, like a virus or bacteria that can cause illness, a host, a portal of entrance, a means of transmission, and a susceptible person. Transmission of pathogens can occur by direct, airborne, vector, indirect, or droplet means. The most important and effective thing you can do to help prevent the spread of infection is to wash your hands. Standard precautions require the wearing of personal protective equipment whenever you anticipate the possibility of splashing or spraying of blood or other body fluids. Following standard precaution guidelines is crucial for protecting you and the people you support from potential infection.